again to my YouTube channel. I hope you had a lovely night, you had a lovely day yesterday, and you had a productive one at that. So I'm here to say something with regarding Kimani Mbugwa's health. So I'm from listening to a documentary that Kimani Mbugwa suffered from the bipolar disorder, bipolar 1 disorder. And the reason he killed himself is because he was left at an hospital, and he just used to do the calling of the father regularly on the phone. So I'm here to say something with regarding the mental health disorders that affect some people. So much as we take physical health much as we take physical health for with the importance that we do, also please take mental health of importance. Because you know why? A person with a mental health disorders, a person with a mental health disorder can also, when we are when we are going through a phase or an episode, please, we require the support, a full support. We require full support. Because your mind, for a person that is suffering the episode, when you're going through the episode, especially we who suffer the mental health disorders, when you're going through an episode, your mind is telling you to do things contrary to your opinion. Your mind is telling you to do things contrary to your opinion, to your opinion. And especially for a bipolar disorder 1, that time is when your mind especially for a person with the bipolar disorder 1, that time is when their mind is telling them that, you know what, you can find a person that is suffering bipolar disorder 1, they get to be depressed. After getting to be depressed, they get to have schizophrenia. Then after suffering all that, now their mind is telling them that, you know what, you're hopeless. That's when the mind is telling them that, you know what, you're hopeless. You cannot do anything. You cannot become anything better. So what you require to do is either one, ending your life. Then your mind also, then when you're suffering with the bipolar disorder 1, that's when their mind is telling them that, you know what, after ending your life, you are tired. After ending your life, you're what? You're tired. So that's the reason now I'm going to tell each and everybody with the people that suffer the mental health disorders, for the friends and families with the people that suffer that, please be compassionate. Be compassionate to them and give them the hope. When they lose the hope, give them the hope. When they lose the hope, give them the hope. And when they are in an episode, don't come and start giving them negativity. Don't come and start giving them negativity, because for the people like me who suffer that, especially the times that we are for example, like me who did have my last episode, I remember was in August. I remember my last episode was in August, and then I remember my other the minimal episodes were in September. Then again, just this week on Monday, I did not know. There are some mental health disorders that you do not know when the episode will come. There are some mental health disorders that you do not know when the episode will come. You just find yourself being a patient. You just find yourself experiencing the episode. You just find yourself experiencing the episode, and after you have experienced the episode, you can even lose track of what you are doing that day. You can even lose track of what you are doing that day. You can even lose track, and I repeat, you can even lose track of what you are doing that day. So this is what I'm going to say. For the people like me that suffer that, when we are either going through an episode, or and then for example, we go through the episode, then after losing our consciousness, we come back after losing our consciousness. Give us hope and encourage us to continue. Don't come and start giving us negativity. Don't come and start giving us negativity. Because it is not our wish to go through the experiences. Because it is not our wish to go through the episodes. So when the episodes come, track the time that the episode has come. Track the time that the episode has come, and after you have tracked the time that the episode has come, if the episode will come past 5 minutes, call an ambulance. And if the episode has come like beyond 5 minutes, call an ambulance. Because that one now, it is past the episode. And it can do what? It can kill me. And it can do what? It can kill me. So when for example, me being a patient of a mental health disorder, when I'm going through my episode, track the time that episode did come, and if it is past 5 minutes, and if it is past 5 minutes, call an ambulance, because that episode can kill me. And I repeat, call an ambulance, because that episode can kill me, and that episode can make me to lose my visions. That episode can do what? That episode can make me to lose my vision. That episode can make me to lose my memory. That episode can make me to lose my vision. That episode can make me to lose my memory. That episode can make me to lose my memory. That episode can make me lose my vision. So if the episode is beyond 5 minutes, call an ambulance. I repeat, if the episode is past 5 minutes, call an ambulance. Call an ambulance, and after you've called the ambulance, make sure the doctor gives you the full reason why that episode was beyond 5 minutes. Why that episode was beyond 5 minutes. And then we patients that go through it, give us hope. We patients that goes through it, give us hope. Because sometimes when we are taking our drugs, there are days that we feel tired. There are days we feel tired. Yeah.
Sawa, tumetoka 10 o'clock tunakuja.
Sawa. Sawa. Sorry for that. There are days when we are taking our drugs, we feel tired. There are days, like for example me, there are days when I'm taking my drugs, I feel tired. There are days when I'm taking my drugs, I feel tired. And after I feel tired, there are days after when I feel tired, there are days I'm tempted not to take them. There are days I'm tempted not to take them. So continuously, for the people that are friends, for the people that are our friends, and for the people that are our friends, and for the people that are our families, please give us hope. Please give us hope. Please give us hope, because it is not our wish to have the mental health disturbed. It is not our wish. Like for example me, it is not my wish to have some issue with my mental health. It is not my wish. Actually, the reason it did come, I was told back in 2019 that the reason actually my mental health came and it started to feel disturbed, the reason it did that was because I'm those children that my mom did not carry me beyond 9 months. Actually, my mom did carry me for 7 months. Actually, my mom did carry me for 7 months. So I'm those people, I'm those babies you call the incubator baby. I'm those babies that you call the incubator babies. So now that's the reason why you could have found me earlier on before I entered my 20s. You could have found me looking at a person, and after looking at a person, you could have found me staring to a person, and after I've stared to you, I lose my track, and after I've lost my track, that person is like, why are you staring? And that person is like, why are you staring at me? Why are you staring at me? When you do not know that you are supposed to do this. So that's the reason why it did. That's the reason why my mental health came and it felt disturbed. So later on, if I could not have gotten the convulsions, then back in 2019, we could not have known that the reason I was staring at people beyond my time was because there was a mental health disorder that was coming, that is called what? Tebelon lobo seizures. That is called Tebelon lobo seizures. So I was admitted in Aga Khan University Hospital for 3 days, and after being admitted then, later on, after being admitted then, now continuously for the last 6 years, I've just been taking the medication. I've just been taking the medication, and after I've taken my medication, I get the episodes. Of which the episodes are not the best. Because there are days that when I'm experiencing the episode, there are days that I could bite my tongue. And after biting my tongue, there are days I could also pee on myself. There are days I could do that. I could pee on myself. There are days I could pee on myself. There are days I could also bite my tongue. There are days I could bite my tongue. There are days I could pee on myself. There are days I could lose my consciousness. There are days I could also feel like I'm drowsy. There are days I could feel like after the episode I feel like vomiting. So, cause we people that go through the Tebelon lobo seizures, after the episode, we feel if sometimes if the episode is not that major, we feel like on Monday I did not feel that way of feeling that I'm drowsy. I feel like vomiting. I cannot stand on my own. That day, actually, God was there with me. Because after the episode, I only did go and I stayed at the chair, and I laid back in the sofa set, and after laying back in the sofa set, I gained my consciousness. But there are days when I'm experiencing when I'm going through the episodes, there are days I feel drowsy, there are days I feel like vomiting, there are days I feel like I cannot even stand on my own. So I prefer to stay at my bed. On my bed. There are days, even when I'm sleeping now, I get the episode. There are days I get the episodes when I'm sleeping, and after I wake up, then I want now to go back to sleep. There are days that I cannot even get the sleep. There are days I cannot even get that sleep. So there are days that I cannot even get that sleep. So that's the reason why sometimes when I get and there are days that even talking like this, I cannot even talk. There are days I cannot even talk because it makes me lose my because my tongue is normally beaten. So now there are days now I cannot even talk, and when I talk, I tend to stammer. I tend to stutter. So, of which it is normally not my wish. It is no, for the people like me who go through that. It is normally not my wish, because sometimes it is triggered by anxiety. Sometimes it is triggered by stress. Sometimes it just comes abruptly. Sometimes it normally comes abruptly. Like on Monday, it did come abruptly. On Monday, it did come abruptly. I did not expect it. I did not expect it. So that's the reason why I'm going to say this. Give us the hope. Give us the hope. Give us the hope. Don't come with negativity. Give us the hope. We people who go through the mental health disorders, give us the hope. Give us the hope. Give us the hope. Give us the hope. Don't talk negativity to us. Don't talk negativity to us. Give us the hope. Don't talk negativity to us. Give us the hope. That's the reason why you can find me. You can find me. You are talking. You can find me nowadays. I do not want a lot of things on my head. You can find me. I do not want a lot of things on my head. That's the reason why nowadays you can find me. I do when I'm told, for example, I go to take something, then I get that person telling me, Miriam, you should do this. That's the reason why you can find me not even paying much attention on them. Or for example, I'm in school or I'm somewhere and I'm going to eat, and then the person tells me that I do, Miriam, you can go buy for yourself. You can go buy for yourself the food. I'll just go. I will not stay there and start arguing with the person. I'll not go there and start arguing with the person. I'll not do that. Give us the hope. Give us the hope. Give us the hope. Don't trigger the episodes for us. Don't trigger the episodes for us. Give us the hope and don't trigger the episodes for us, because the episodes are not the best. 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 So give us the hope, and you'll get to, once you get to stay with some of us, you'll enjoy your life. Once you get to stay with some of us, you will enjoy your life. So thank you for listening to me. Do have yourselves a lovely day. Watch, like, comment, share, and subscribe.